All right, well, February is Children's Dental Health Month, and knowing the perfect time to get your little one to the dentist is key.
And here with some answers, we want to welcome Dr. Paul Galloway of Cornerstone Children's Dentistry. Now, Dr. Paul, when should parents take the kids for their first dental visit?
The American Academy of Pediatric Dentistry recommends that a child have his first dental exam by 12 months of age. Obviously, that's a lot sooner than most parents are aware that their child should be at the dentist. But this early visit is very important to teach parents what to do and what not to do and how to take care of their child's teeth so that problems can be prevented rather than corrected later on.
Yeah, because you don't want to wait till they're like 12 years old and then take them, because a lot of, obviously bad things
Right,
happen.
a lot of things can happen. And also, when should they start brushing the children's teeth?
As soon as the tooth starts to appear in the mouth.
So you can just get one tooth and brush it?
Absolutely. Perfect. It's best to start with a little finger brush when those early teeth come in, and then when they start having teeth on the top and the bottom, use a child appropriate size regular toothbrush.
Wow.
How long should kids brush their teeth? I know that's been an issue. Should you do it real quickly? Should you spend like 15 minutes? What's the average time usually?
About 2 minutes is what it takes to do a good, thorough job with brushing. And most kids do well less than that. Most adults don't brush for 2 minutes.
Yeah.
But it's very important, especially for children, to have an adult to help them with the brushing. And the flossing is also critical for any child that has teeth that are touching. Flossing is important because we can get cavities between teeth as well.
And toothpaste is not food either.
Right, exactly.
Yeah, I got to teach you that. That's tough.
That's true.
I fell for that.
Especially because a lot of the kids' toothpaste are sugary and sweeter than what we use.
And parents should not use a fluoride toothpaste on children under the age of 3.
Really?
You really want your child to be able to spit out the toothpaste before you use a fluoride toothpaste. Up until that time, you can just use water on the toothbrush, or you can use a non-fluoride infant tooth and gum cleanser. Otherwise, you can run the risk of getting too much fluoride, which can cause some damage to the permanent teeth.
Now, you've been going around the whole month of February to local schools, and what are you teaching the kids out there?
Primarily, we try to teach the kids why it's important to have healthy teeth, why we need our teeth to be healthy for a lifetime. Practical things to do to help keep our teeth healthy, so things like brushing and flossing. We use a dental puppet to demonstrate proper brushing and flossing techniques to the children, and they enjoy that. Talk a lot about diet. Most kids and adults too don't understand that a diet has a tremendous impact on the rate of decay.
Very true, yeah. Do you show those pictures of the teeth but it happens to your gum stuff if you don't brush? Because those freaked me out when I was a kid. Those are very effective posters, by the way.
We do those sometimes, yes, when other things just don't seem to sink in.
Yeah, that works. Very cool.
And so if parents are out there and they kind of have questions, especially we have a lot of new parents that watch, how do they get in touch with you? And if they bring in their 12-month-old or older, correct?
Right.
What ages do you see up until?
Most kids up until around 14 or 15 years of age, although we do have children older than that that have special medical or behavioral needs. So I think it's important to take your child to a dentist who is prepared to treat the needs specific to children, and that includes behavioral needs as well. That's one area that pediatric dentistry is much different from adult dentistry, in that we're prepared to handle the behavioral difficulties that often come with children at the dentist office, and also to be able to handle specific dental problems that occur in children that don't necessarily occur in adults.
And I think it's good, like you said, you start off at 12 months and you take away that stigma of going to the dentist for the child.
Absolutely. In addition to the education part of that early visit, which teaches parents how to avoid certain problems, it also helps to get the child comfortable in the dental environment, so that when they become older and need a little more invasive dental treatment, that it's not quite a scary thing for them.
Right.
And one other difference that pediatric dentistry has in relation to adult dentistry is that because we focus on treating only kids, our office is set up to make that more comfortable and more entertaining for them. So from stuffed animals and murals on the wall and cartoons.
Kid-friendly.
Yeah, very kid-friendly.
Perfect. Well, you can check out Dr. Paul, of course, at Cornerstone Children's Dentistry. That's in West Ashley on Charlie Hall Boulevard. 556-1655. Great to see you.
Thank you very much.
All right, thank you. Stay with us. Lloyd Doppler effect is coming up.
Ooh.